My dear student, good morning. Today I like to discuss with you acute myeloid leukemia. Last week I discussing about the acute lymphoblastic leukemia. But today I like to highlight all of you with acute myeloid leukemia. Leukemia, you know, the types of the leukemia already last class I told you. There are 4 types of leukemia. One is acute lymphoblastic leukemia. This is about 75%. Then acute myeloid leukemia is 25%. Then chronic myeloid leukemia is only 3%. Then another one is congenital leukemia. Remember this one. Now today I like to highlight with all of you acute myeloid leukemia. Remember this it is only 15 to 20%. Remember this one. Now how it classified? Classification done by the classification of France, America, British classification done by M0. Look to your book. M0, then M1, M2, M3, M4, M5, M6, and M7. Remember this one. There are 8 types of. This is France, America, British classification. You look your box, the classification. Now how the patient is present to you. How the patient is complaint of the patient. The sign syndrome is 80%, 80 to 90% similar to acute lymphoblastic leukemia. Remember this. Only 10% is dissimilar. Only 10% sign syndrome is dissimilar with the acute lymphoblastic leukemia. Remember this one. There is a stigmata of the acute myeloid leukemia is, first of all, you see there is chloroma. Chloroma means there is swelling over the suprapubic or supraorbital region. There is a swelling in the supraorbital region. This is the collection of the malignant cell. This is called chloroma. Then proptosis. You everybody know what is proptosis. Then proptosis. After proptosis, then bleeding manifestation is more here, and DIC is more in here. Then gum hypertrophy and leukotritis. Leukotritis means hemorrhagic infarction of the central nervous system. What is leukotritis? This is hemorrhagic manifestation of the central nervous system. Remember this one. This is the extra manifestation of the acute myeloid leukemia. But here, remember this: bony tenderness and anemia is less here. Any pallor. Bony tenderness and pallor is less common in here, but organomegaly is more greater than acute lymphoblastic leukemia. Remember this. What is the difference between the acute lymphoblastic leukemia and acute myeloid leukemia? I told you 80 to 90% clinical manifestation more or less acute lymphoblastic leukemia, but only 10% extra stigmata in acute myeloid leukemia. I told to you. Now what are the investigation? Investigation also like this. Investigation also already last class I told you complete blood count with peripheral blood film. Complete blood count, what will happen? The hemoglobin will be reduced and ESR will be raised. Then there will be an peripheral blood. There is a myeloblast. Peripheral blast, a plenty of myeloblast in the peripheral blood film. Then go for bone marrow study. Heartbeat in mode, you do the morphological study like cellularity will be hypercellularity, myeloid erythroid will be increased, then leukopoiesis is increased but erythropoiesis is decreased, megakaryocyte is scanty, but this one. And next we go for cytogenicity and immunophenotyping. Cytogenicity, immunophenotyping is done for more accurate diagnosis and treatment purpose. For treatment purpose, do this investigation, more accurate diagnosis. We do immunophenotyping, that is types of the cell. It is a B cell or T cell or CD3 or CD4 or CD5 or CD13 or CD17 or CD27 like this. Good treatment purpose, we do the immunophenotyping. Then cytogenicity. Cytogenicity means karyotyping. Do any chromosomal abnormality or chromosomal translocation is there, like Philadelphia chromosome present or not, we did the cytogenicity. Another test we do, cytochemistry. It is a differentiating between ALL and AML. In AML, that is myeloperoxidase and Sudan-Black is positive. But in acute lymphoblastic leukemia is in acid phosphatase. Acid phosphatase is positive in acute lymphoblastic leukemia. Remember this. This is the investigation. Finally, you go the treatment. Finally, go the treatment. Treatment is a supportive treatment. I already told you last time. I told supportive treatment, nutriphenic diet, correction of the anemia, correction of the dehydration, correction of the coagulopathy, correction of the tumor lysis syndrome. This is the supportive treatment. Then the specific treatment. Specific treatment is protocol-based multi-agent chemotherapy. Protocol-based multi-agent chemotherapy should be given. In here, protocol is different from acute lymphoblastic leukemia. In here, will be modified MRC 12 and MRC 96 protocol in case of acute myeloid leukemia. Finally, you go for bone marrow transplantation. Remember this one. Now you should know what are the oncological emergency. Everybody should know what the complication or oncological emergency. That is tumor lysis syndrome, superior medicinal syndrome, superior beta syndrome, then neutropenia, febrile neutropenia, then typhlitis, then mucositis, then superior medicinal syndrome, this or superior beta syndrome, then infection space and cardinal falsi. These are all of the complication or oncological emergency. Remember this. This is all about acute myeloid leukemia. Thank you very much. Thank you very much for patient hearing.